mostly down here because I'm sure this is kind of your sore area.
This is Dr. Julie, Ellie. She's your friend. I know you don't know her yet.
It's okay, sweet girl.
Oh, I hear babies. Yeah, put them right here where she can see them. That might help.
I'm sorry.
See your babies? You can show them off to us.
Yeah. You're sweet.
Do you see how much calmer she looked when you brought the babies?
You did such a good job with those babies. You're such a good mama. Yeah.
Yeah, she just astounded us. She is the easiest mama we have of all of them. Like, you have to do the least work with her puppies. But more with her because she makes milk so well and everything. She gets skinny a lot faster, and we have to work harder to keep her weight on and support her.
I didn't realize Fender was still there. I'm like, what is that? I'm like, oh yeah, he's still there.
He's just out so cold. He
just disappears into the couch. I'll fully sit.
Ellie, what does that feel like? She's watching your face so closely. As you moved, she was following your face.
Okay, baby. It's okay. What do you think? She might feel it a little bit because she's just popped a bunch of puppies out.
Yeah.
And she's healing.
She might feel something right away. It might even be like, ooh, that feels good. What is that? I like it.
Yeah. And she might feel it. It might feel good. She might also feel, you know, if she's already got a little discomfort, she might feel like almost like a little pulsing or a little heaviness.
Kind of a pressure or something in that area. Like, what's happening?
Well, and it also increases blood flow. So an area that's already inflamed, when you put more blood flow into it, it almost just feels kind of intense, intensifies. It's very subtle.
Look at her face, though.
Yeah.
Her face is calming down a lot. She is calming down a lot.
It probably feels good to her then.
Yeah, look at that.
Her eyes softened.
Yeah, totally. Look at her face. That's totally different than a minute ago.
You can lay down. You can lay down, baby.
Good girl, Ellie.
Sweet girl.
Good girl. She says, I know they're there, but I'm not even worried about them now. Such a pretty girl.
You are. Good girl.
If you're tired, sweetie, you can lay down. She looked down. I wonder if she was thinking about it.
She might in a little while. She may be just a little bit too nervous because, you know, you got to understand she's not only in an unfamiliar environment for herself, but she's also her babies are here. So she's on mama bear mode.
But she's doing really good for that.
Yes.
I mean, look at that.
She is a lot more relaxed right now.
And I haven't seen any aggression at all out of her. She's, if anything, it's been uncertainty.
Oh, you thought about it, didn't you?
Almost.
You thought about it. Yeah, it's okay, Mama.
Good girl, Ellie.
Okay,
good
Mama.
girl. Does that feel good? You look like you're relaxing more. Your face just looks less concerned.
She'll probably crash.
I think so. Look at her eyes. She's already starting to.
She's like, I want to go to sleep, but I don't know if I should.
I don't know what you're doing to me, but it's making my eyes close. Look at that.
Oh, that's too funny.
That feels so good. Whatever it is, I like it.
She's falling over. Yeah.
Yeah, she's totally. Oh. I was also contemplating, I wonder how often doing a treatment like this after birth would actually prevent birth issues the next go round because things have been adjusted back. Whereas if they're not adjusted back, it can continue to get worse and worse.
You mean with mama?
Yeah, with mama.
100%.
And it could make, I mean, she does great with delivery, but it could make delivery even easier for her next round.
Totally. Yeah, it's the same with people.
Look at that. She
women.
gave up. Lay down. Oh. Then you hurt someone.
Yeah, it makes a big difference, especially. Well, and also too, you can take it a step further because healthy mamas that have their nervous systems that are 100% connected to the rest of their body are going to have healthier puppies in general.
Mhm.
Same with humans. You
Yep.
know, that's why chiropractic during pregnancy is so important, not just for labor and delivery, but for development of the baby.
I wonder if that's one of the reasons that I did do pretty well, because I did periodically have
100
chiropractic. I did a lot of other
100%,
things too,
yeah.
but I mean, here I am, someone who would be considered high risk,
Right.
and yet I had all these babies,
100%.
and I had huge babies, and I was able to deliver them safely.
Yeah.
I mean, that's like unheard of, but
Yep.
I have to suspect it had to do with that.
Yep. And then yeah, because another thing that happens, as you know, when you're pregnant, you know, your tissues get more laxity in them, you know, your ligaments and stuff, so that they can expand and you can, you know, give birth. With that comes less stability. So after pregnancy, you're gonna have, you know, more instability in your pelvis, you know, in your spine, and you know, people end up with pelvic floor issues and, you know, sacral issues. And so if you're staying adjusted during your pregnancy, even though you're getting laxity in the ligaments, you're not going to end up so far imbalanced that it's that much harder to recover.
To get it
You're
back,
going to maintain that normal tone. And then, you know, after you deliver, you're not going to be like completely out of whack. And then you can imagine, you know, people that never get that corrected the next time they get pregnant. Well, they're going into it all
out of whack to begin with.
And so a lot of times, and it's especially an issue if they're all out of whack in their pelvis and their pelvic floor, because that's the birth canal.
Right.
So, you know, that's the whole, I don't know if you've heard of Webster's technique, but that's
absolutely. We used it multiple times.
Yeah, it's a pregnancy technique that will help keep the baby in proper alignment, birth position rather. And it's amazing how much better deliveries are, and also pain. You know, like a lot of times women will have horrible sciatic pain because everything is loose and there's this thing sitting on your sciatic nerve. So yeah, I mean, it's it should be common sense, but it's not taught, you know, to people. Like the concept of structure and balance is just underappreciated.
It totally is, and it's so foundational. It's just like nutrition. Those two, if you deal with those two, you start everything from a better place.
And that's why women who, you know, who are into fitness, who are into weightlifting and things, you know, if they do that before they get pregnant and they do it throughout their pregnancy, I mean, they have so much better, you know, labors and stuff and recovery because they have strengthened all those muscles. So they're not gonna, you know, their body isn't gonna go to mush and everything go blah, you know. So yeah, it's all, of course, then, you know, that doesn't mean that chiropractic isn't necessary, because if you work a body that's imbalanced,
you can actually work the muscles to hold it in the wrong place. It can make correction hard too.
Correct. So it all works together. You can't have one, you know,